So back at the Griswold Method podcast, where I get to talk to super interesting healthcare practitioners that are doing all kinds of cool things, I have one of my favorite people, DR.JOE, and we do a lot of cool things together. And this is one of the things that we do together that we're going to try to help you understand. And really the fancy word that you're hearing all over right now is the term peptides. Peptides, GL1Ps, all the letters, and the BPC 157, TB 500. I mean, come on, the letters are crazy.
Yeah.
It's like the codes and things. It's really bonkers. And so DR.JOE and I have been in that game for a while. We've done a lot of research together in that game with our bodies and bodies of our patients, bodies of our friends and family. And so we're just going to drop a little knowledge base on you. Really what I wanted to hear as I started diving into this more, you started to hear more content from me about it, is your experience with peptides and why, what'd you start with, all that stuff, and then maybe we can learn from that.
Really the whys for me was, a lot of pain, joint pain, from what I do, do exercise, eat well. I've done about every diet you can think of. I come to see you, and then it's just like stuff's still lingering. So then I always thought in my mind that, man, at some point I'm gonna go into TRT, testosterone, that kind of therapy. But then I was like, I don't know about that. I don't want to do that all the time. So then I hear about peptides. Yeah, peptides like I was like, what the hell is this peptide? It's just a proteins, basically, in a nutshell. So I just did a deep dive on it, and I listened to a lot of people and read up on it, and I was like, I'm going to try this. So the biggest one for me is one of my biggest goals was to get out of joint pain, just knees hurting, hands hurting. So I exhausted everything. So then, like you said, from the lettering, I tried, the main one was BPC 157, TB 500, stack first. I was like, and another thing too is there's minimal to no side effects with these things. That was the main thing. Whereas with testosterone, once you're on it for life, and all these, your liver, and you do blood tests. So it's almost like that without any of the major side effects. Other thing too, like from what I'm learning from peptides, you're treating people, or you're treating yourself at the cellular level. When we say cellular level, we're talking like mitochondria, that kind of stuff, instead of just, I'm just going to treat a symptom, or So anyways, I tried a 1 month. Within 2 weeks, I responded, and I was like, wow. All my pain, I'd get out of bed and I was like, man, nothing hurts. My knee doesn't hurt. My hip doesn't hurt. And when I say hurt, meaning I've already done the work. I go to a chiropractor, I do all that. But just as that little nagging, like the squeaky wheel, like, you're like, oh man, there's just something there. It just goes away. And so, I did a cycle, did what they supposed to do, the regimen, and waited, and then stacked it with some GHK CU with copper, GHK with copper. And, that's about the extent. My newest one is, thymosin alpha 1, and that's mainly for immunity, bacteria, viruses,
building up your immune system.
Build up the immune system. So I was like, man, I need that because I need sun. There's no sun right now. And when these times of the years, my immunity just goes to crap. So far, I just started the cycle probably about a couple weeks ago. So now I'm down to just, 1 shot a day, and we'll see how it goes. But I just kind of experimented on myself, to be honest with you. I've never met anyone that's been on them. I asked around, they're like, I don't know. So you're really only the first one that I've ever talked to outside of my network of people that have tried it and have done it. So
I remember, I'm his chiropractor, and I think that we just already violated HIPAA a lot anyway, so whatever on that one. But I saw the change in his body.
Yeah.
And so I had been playing with them for myself.
Right.
Wrestling people all day. My body hurts. And what's interesting is like, just like you said, you get out of the bed and almost like you look behind you, like, where's the soreness? I was like, you expected it to get out with you and it didn't.
Right.
And that's bizarre. But really what I want you to understand is what a peptide is. When we say peptide, amino acids. Let's talk about how that works and what does that look like. And so if we look at amino acids, there's really 9 of them, and we can go into that. I'll do that later in some sort of presentation. You can check that out on a different source. But these amino acids are going to stack into what we call a protein. And so when we say TB500, BPC157, that it's specifically the code that we're using in those peptide or in that amino acid that we're actually causing it to plug in. So what you want to think about is the difference in TRT that my understanding, and I think you would agree with this, is the differences in TRT is we're shutting down an organ system in order to reproduce it synthetically.
Right.
Where peptides fall into where I really like them and where it filters through my philosophy, where the body has to operate, and it will always operate given the right conditions and in the right environment. You've heard me say it before. It's going to do what it's supposed to do every single time, right? The body's going to do what it's supposed to do given the right conditions and environment every single time. Mm-hmm. All peptides are doing is they're giving you a small code to tell the organ to do the thing that it was already doing anyways. Right. So an example, right now I've been, and I have a protocol that I've put together that works with the GH axis. So like growth hormone axis. How can you activate on the pituitary gland and what's going to activate? Now, is it growth hormone? Well, no, that's illegal. You can't have it.
Right.
But if you're young enough, and I'm not saying 15, 16, 17, 18 years old taking these peps, what I'm saying is if you're in our age group, we still probably have some growth in our system. Could we act on it by giving it a code, putting it into our bloodstream, giving it a code to get that pituitary gland to secrete more GH? If I can do that, that's what I want to do. Yeah. I want the organ, I want to give it information so that the organ will release it in the way that it's supposed to, i.e. what you're doing with the thymosin. We're going to release from the thymus gland. We're going to pick up more T cells, and we're going to have a better immune system.
Right.
So he's not taking his immune system through the bottle, which is other hormone replacement therapies, which I'm not knocking them. If you're on them, do what you do. I'm not, whatever. What I'm talking about is peptides and the confusion that there is, right? And I think that that's the wildness about it. I also would say, and I know that you and I have talked about what we see in the offices of people that have lost 30, 40, 50 pounds, 70, 80, 90 pounds. Is that great for them? What's your opinion before I rant? Because I'm going to rant probably.
Well, you got to remember, like a lot of times those GLP-1s, that's just kind of one of the, I guess, side effects, I guess. I don't know what the better word is, but that's not what it's what they're used for. Mm-hmm. It's really for brain. It just happens you lose weight.
Yeah.
It is. So really, I don't know if you're getting a 2-for-1 or a 3-for-1 out of that, but it's just everybody focuses on the weight loss portion of it.
What I would also say is I see the muscle mass just going away, right? I see more pancake butts than I've seen in a long time in my career.
No acetol.
That's it. And we're on pod. We can say whatever we want. But the truth is I'm seeing people that are losing 60, 70 pounds, and probably 30 of that is muscle mass. And if it's done correctly, that's not the case. You shouldn't have that happening if you're protein diet rich, if you're doing resistance training, if you're actually exercising and moving your body. These are just tools. I think people think that, like, you said it earlier, and I'm just going to highlight and run back what he said. I use peptides, but I'm doing all the other things.
Mm-hmm. Yeah, I've exhausted all the other possibilities.
Well, you're doing them too. Yeah. Like you're adding those
it's just an adjunct to turn on, like you said, turn on the thymus gland, because as we age, we're going to get a catabolic state. We're not an anabolic. We're not building anymore. So it's just going, hey, I still need you. Let's get it. Let's wake it up.
That's it. And it's like, if you had a small key, i.e. peptide, to turn on an organ to help it produce better.
Right.
I'm in. Because the body's going to do what it's supposed to do given the right conditions and environment. You are creating the right conditions and environment, and that's what aligns with me as far as what I believe in how we practice our healthcare. I just want the body to do what it's supposed to do and run it optimal.
Yeah.
How can we get that?
Right.
How can we achieve that? And I love the fact that this is a healthcare practitioner that sees me once a week, that works out 3, 4, 5 times a week, always does the soft tissue work, doesn't skip out on the massage therapy, soft tissue work. He's eating super clean. He's got a better abs than I do. And how old are you?
54.
So, and he's a decade older than me.
And I'm Asian, and you are too, though.
Well, he's actually 12 years older if we're going to be real. But he's done all of the other things. And so he's not looking at peptides as I'm going to get to this health state.
A quick fix. Yeah.
He got to that health state first. Then he added in, said, I need the extra little bit that's going to push me over the edge. And I think that's the beautiful thing. Yeah. I'm suffering from aches and pains. I'd like some regeneration. And so what he's done with the BPC 157 and the TB 500 and stacking them together in the right dosages and the right dosages with clean, reputable sourcing, that can be magic for somebody.
Yeah, because I've had some old injuries, tore hamstring and, cartilage here and there. And, with that, it helps with the regeneration.
Yep. But I've had patients,
soft tissue.
There's even somebody that you've referred to me that did not have great results with PEPs.
Mm-hmm.
This patient has just gotten into the workout thing, just gotten into soft tissue work, just starting to understand the mechanism within his body. So it's like, I don't think that this patient was looking to take them just to get rid of all of his soreness, but you got to do the other stuff.
Yeah.
And I think that's
sometimes maybe it allows you to do those things. You're like, I can't run because my knee. Well, now you can walk.
Yep. You can begin to do the things.
Because you're repairing the damage from the past.
To me, if I can use something to get me to my health goals and then I can use that to maintain it.
Yeah, that's what I'm looking at.
Let's go. Yeah. Like red light therapy, let's go.
Right.
It's been going to rain in Tulsa for the next 5 days. I'm going to be in the red light. Otherwise, I'm going to be super clinically depressed.
Right.
I know that's a fact.
Right.
I'm just looking at how can we leverage technology. It's out there.
Right.
The knowledge is there. I've done the research. You can do the research, or you can follow me and I can do it for you and tell you about it. Or Dr. Joe. But the technology is there for you to take it.
It is
better than it ever has been before.
It has.
Like you've got the opportunity.
So many modalities.
Like we're talking about Abraham coming out. Like we're in 900 years. But I don't know about 900 years. But the thing is that we're going to open that conversation up about what peptides really, with a gentleman that is an educated physician that's done them himself, who I have seen him biomechanically for several years, and I personally saw changes in the inflammatory process, changes in what was responding in his body, and I wouldn't say that's clinically researched because it was anecdotal. I just told you I saw it. We didn't write it down. We just said decrease in inflammation, etc. But I'm just seeing it happen more and more, and the more people that I talk to that are doing those types of things, leveraging it that way.
Well, would you rather do the peptides and treat yourself at the cellular level, or live on Advil, painkillers, antidepressants, antibiotics, on and on and on and on and on? The pharmaceutical companies would love that.
There'll be a way that they love the peptides soon.
That's why, the peptides aren't so popular, because if we treat ourselves at the cellular level and get our bodies doing what, like you said, what they're supposed to do, and as we age, we're just getting a little stimulus to wake them up, then we get back to where we are. Then we can do what we want to do physically, mentally, spiritually.
Holistic healthcare.
There you go.
That's it. Roll it all in one. How can you do it? Clinically aligned, holistic healthcare. If that's information that you want, check out the podcast more often. Yep. You're going to see Dr. Joe more often. I think we've got some more magic to work out with him.
See this guy for the protocols. He's got the protocols. That's the main thing, is just, it's not that get it from a reputable source, but it's like, what do you stack with what?
What time do you take
what
it?
time you take it? What's the interval? How much? How do you reconstitute it? It sounds like a lot, but once you kind of get in the flow of it, it's really not that hard and not that difficult.
It just has to be given, like done correctly can be beautiful. Done incorrectly, it can be a nightmare. I've had some giant wasper stings look like a big giant whelp on my stomach because I was like, didn't put the right stuff in that one, and maybe the purity wasn't there. So I think you have to be picky. But done correctly, just like baking a cake, all the ingredients are right. It's amazing.
It is.
I've made cakes that were not amazing because that I didn't know all the ingredients, how to do it, when to do it.
You're winging it. Don't wing it. See this guy.
No. There you go. I didn't ask for that. We'll take it. We'll shut it with that.